I'm Bill Rapisi, President and CEO of the Lymphatic Education and Research Network, and I just want to welcome you and say how delighted we are to have people from all over the world here today for this brilliant symposium. It's our honor to be able to present these to you free of charge, but that's only possible thanks to LE&RN donors, and that's where you come in. This is the time of year when LE&RN has its annual appeal. And right now you have an opportunity to double your impact thanks to a donation from Ian Lehman and Stephanie Free, who gave us $50,000 as a match. So when you see the button to give to the appeal during the symposium, please give generously so that we can continue to bring this programming to the world and continue to fight against lymphedema, lipedema, lymphatic malformations, and all lymphatic diseases. Thanks for your time. And remember, when you see the button to double your impact, please click it. Thank you.
I'm Chuck Ehrlich, and I'm the lead author on the Lymphedema and Lipedema Nutrition Guide, and I'm here today to talk about changing sleep, nutrition, and activities to feel better. And we have the question box, which I will try and keep an eye on, and we'll take questions at the end. Today's series is made possible through the generous support of these sponsors. And we have two important disclosures and disclaimers. The first is that LE&RN provides this information for your use. The second is that I am not a licensed healthcare provider, and that you should take the information that I provide and use that to talk with your healthcare team. Further, of course, I also have published a number of books on lymphedema. So we're going to talk today about changing to feel better. The goal is to help you feel better and minimize pain. And we'll talk about research showing how sleep is important, the factors that influence sleep, and provide recommendations to help you sleep better, eat better, and do better activities to help both exercise and avoiding inactivity. And we'll also talk a little bit about nutrition for minimizing the effects of COVID-19. Sleep is an important health activity that does not get enough respect. Most people need 7 to 9 hours of sleep, even though they think they can get by with less. And that this should include the period from 2 a.m. to 4 a.m. and include a whole series of different sleep stages that helps the body in multiple ways. And we'll go through some of the ways that this is important. The most common sleep issue is that people don't get enough sleep. They think they can get by on less than 7 hours of sleep per night. And this does not work well for people. And the second most common issue is obstructive sleep apnea, that is where the breathing is impaired. Sleep is interrupted because of snoring and impaired breathing, the airway being blocked. And this is both harmful to the person with the sleep apnea and anyone who is sleeping within earshot of them. There are other issues about interrupted sleep, also known as being apparent or trying to deal with other things. And there are also medication effects that can interrupt with normal sleep. One way of looking at sleep is in terms of multiple dimensions. Are you satisfied with your sleep? Are you alert during the day without dozing? Are you sleeping? Is your sleep timing good? Is your sleep efficient? And are you getting adequate sleep duration, that is 6 to 8 hours per day? And you can evaluate your sleep using this scale to say whether you're sated. So if you rate each of these factors on a score from 0 to 2, and see how you're doing in terms of your sleep, you end up with a scale of 0 to 10, where 10 is good sleep health and and 0 is poor sleep health. And many people fall someplace in between, depending on how things are going. Sleep issues affect health outcomes, particularly if you're not getting adequate sleep. The risk of accidents is greatly increased. It also contributes to a number of other health conditions. And sleep affects both the body and the mind. All major body systems are affected by sleep, including and especially immune function and metabolic health. And the mind is affected, both in terms of cognition, and we'll talk in a second about some of the physical effects. So that getting adequate sleep is important for learning, that you will not learn if you're not getting adequate sleep. And this is an issue for many young people, particularly teens. And sleep is bidirectionally linked to mental health issues. So that mental health issues will interfere with sleep, and not getting adequate sleep will increase the likelihood of mental health issues. And sleep is also linked to obesity and weight gain. In particular, if you're not getting adequate sleep, you will not lose weight. And not getting adequate sleep increases your appetite and the desire for comfort foods that are weight promoting. It slows down your metabolism. It decreases your energy and your ability to exercise. And we'll look at some details on that. And again, sleep apnea is independently associated with increases in the metabolic syndrome. There is an epidemic of short sleep in the United States that's been going on for a number of years, and this coincides with the epidemic in obesity. So that since the 1940s, people have been sleeping less and gaining weight. There are a number of factors that contribute to this, but it's in addition to sleep, but it's clearly part of the trend. It's something that's been happening. And if we look at the prevalence of short sleep in the United States and the prevalence of obesity, we see that there's a common overlap, that many of the people who are not getting enough sleep for one reason or another are also those people who are obese on a statistical basis. And obesity increases sleep issues in multiple ways. We talk a lot in the nutrition guide about gut dysbiosis and the changes in the microbiome that are related to obesity, but these also affect the sleep architecture, and the influence mood, influence cognition, other things. Apnea is linked to congestive heart failure and lymphedema risk, and obesity and fatty liver disease also contribute to sleep issues by reducing your ability to exercise, that is, muscle strength and the ability to do things, and your desire to exercise. And there's even new research showing that restless leg syndrome may be caused by gut dysbiosis. By the restless leg syndrome is something that affects older people, where the legs are twitchy and it interferes with sleep, and it may be caused by gut dysbiosis. There's new research showing that the brain lymphatics are very, very important because there is a newly discovered or rediscovered lymphatic system in the brain that removes beta amyloid plaque and other waste products into the lymphatic system. then this lymphatic system that does this waste removal is only active during sleep. And when you sleep, your brain shrinks by 65%. The space around the brain expands. The cerebral spinal fluid flows increase, and it's basically like you have a rinse cycle for your brain, that during sleep, it is able to physically remove the waste products. And if you don't get sleep, you don't get all the cycles of sleep, you don't get to clean your brain every night. The sleep issues are linked to lymphatic activity and the increase in toxic plaque buildup that is the cause of Alzheimer's disease. And then other things that aging, injury, and other things can also affect the function of the lymphatic system. There's a self-reinforcing relationship between pain and sleep, so that if you have pain, you may have trouble sleeping, but also sleep issues increase the perception of pain and the experience of pain on a day-to-day basis. And pain medications can impact sleep and increase the risk of developing sleep apnea. Opioids can also have other things, can interfere with sleep in a way that reduces their analgesic effect, as can antidepressants. What's really interesting is that melatonin has multiple effects on multiple body systems. And we're going to talk about melatonin in several places today, because it can help with pain, and melatonin supplements can help reduce pain. But also it affects sleep, it affects immunity, it affects metabolism. It's a very, very interesting hormone and neurotransmitter, where some melatonin is produced in the pineal gland and some is absorbed from foods, particularly plant-based foods are high in melatonin. And what happens with melatonin is that during darkness, the melatonin levels increase, which is what triggers the sleep cycle. And low levels of melatonin can cause sleep issues, and they have been linked to weight gain in postmenopausal women. And melatonin, of course, decreases with age and can decrease from light exposure or the use of beta blocker drugs. Food choices can influence sleep, that in particular eating of vegetables or a plant-based diet are associated with higher melatonin levels. You also want to avoid sugar in general, but particularly sugar-sweetened beverages, which is shown statistically to be associated with short sleep. The combination of the beverages and the fluid and the caffeine and the other factors. And caffeine is something that you should limit in order to get good sleep, and limit the timing of caffeine. And alcohol, it interferes with healthy sleep. And basically you should just avoid alcohol completely. It does not help you get good sleep. It does not help you in it is not doing anything really good for you. There are also minerals that affect sleep: iron, magnesium, and zinc. And these have been shown to help with insomnia, and you may need to monitor these levels. Particularly, many people with lymphedema or lipedema have deficiencies of these minerals, And these deficiencies may indicate that they have some form of celiac disease or other form of gluten sensitivity. And we recommend avoiding gluten. And you may also need supplements to correct these deficiencies and help improve sleep. Activities are important for sleep, so that the more exercise you get, you're more likely to be able to sleep. In the study from the Women's Health Study, the data showed that short sleep was associated with doing less health promoting physical activity the following day and being more sedentary, and that more moderate physical activity during the day, 20 minutes or more, was shown to reduce the likelihood that you would get shorter than necessary sleep the following night. So that there's this, again, there are these bidirectional relationships between what you eat and how well you sleep, pain and sleep, activities and sleep. And sleep issues are associated with lymphedema risk factors. So that we know that obesity is a risk factor for lymphedema. Also, many people with lymphedema have chronic venous insufficiency. Interestingly enough, sleep was reported in women with breast cancer prior to treatment. They were having poor sleep. And of course, anything stressful interferes with sleep. So it all comes together. There's almost no research on sleep and lymphedema. There was one study published recently of 43 lymphedema patients, not a random sample of patients, but it did find that almost all of them had obstructive sleep apnea, and that if the lower extremity lymphedema patients, the sleep apnea correlated with limb size. So the more severe the apnea, the larger the limb size, and that 56% of the upper limb lymphedema patients also had sleep apnea. So anyone who is overweight with lymphedema should be screened for sleep apnea in order to help be able to treat this condition and minimize its effects on your overall health. So we know that obesity and metabolic syndrome, all of these are linked to sleep issues, that they increase the risk of lymphedema complications. They promote gut dysbiosis and the overgrowth of gram-negative bacteria in the small intestine. The gram-negative bacteria have a tough outer shell made up of endotoxins or lipopolysaccharides. That these particles from the exterior shell of the bacteria can get from the gut bacteria into the bloodstream, and they stop the pumping action of the lymphatics, and they make the lymphatic vessels leaky. So this is, again, you want to stop feeding the gram-negative bacteria sugar. That's what they love. That's what makes them reproduce very quickly. They also contribute through the fructose component of the sugars to the incidence of non-alcoholic fatty liver disease. And there's, again, a symbiotic relationship between fatty liver disease and sleep issues. And fatty liver disease increases the lymph output from the liver. The liver normally produces half of the lymph in the body, but when the liver is diseased, it goes up by as much as a factor of 5 to 10 times. So this increases the load on the central lymphatic system and the swelling from lymphedema everywhere in the body. There's some research on sleep in lipedema, that shows that sleep issues are very, very common. An analysis of 51 patients from Dr. Herbst showed that difficulty in sleeping showed up in 80% of the stage 1 lipedema, and that decreased somewhat by stage. Also, nocturnal urination, frequent nocturnal urination was common, which is also interrupts sleep, and that the incidence of obstructive sleep apnea increased by lipedema stage. And so this was very common. We also looked at a sample of Dr. Eicher's patients, and their scores on this SATED score scale that we covered a few minutes ago showed that they were really not sleeping very well, that they were, this was a major issue for many of them. And part of what happens with lipedema is that sleep, of course, lipedema is painful fat syndrome. You may have pain from lipedema. You may have abdominal pain from gastrointestinal issues. There are other headaches and joint muscular pains associated with lipedema. The lipedema is associated with hypermobility or Ehlers-Danlos syndrome, and this is also shown to be a risk factor for obstructive sleep apnea and high rates of excessive daytime sleepiness because of the physiological effects of the hypermobility. So what can you do? How can you change this to feel better? And this is a whole series of interlocking cycles of things that affect each other. And I want to provide some guidance on things that you can do to start feeling better. But keep in mind, this is the idea that change just happens in an instant and is a sudden transition from one state to another, works in quantum mechanics, but it doesn't work so well in human behavior. For people, change is a process, and change goes through predictable stages, and you need to work through the stages and make some small changes, show the changes that work, build on those, and start to make more and more changes, and do what you can within the constraints of your life. And there's more detail on this in the lymphedema and lipedema nutrition guide in terms of how to do that. We're going to step through some of these relationships and what I suggest for how to move forward with this. But you need to find what works for you, take it one step at a time, learn from your experience, and increase your self-efficacy. Now, I recommend that you start with food, because what you eat, when you eat, is a modifiable behavior, and it feeds into all of these other parts of this cycle. And we recommend a whole food diet, mostly plants, fermented foods, colorful diet, a lot of variety of spices and food types and things and flavors, avoiding sugars, particularly fructose, that is the sweeteners that are higher than 50% fructose. So plain sugar is 50% fructose. A lot of the other sweeteners, the high fructose corn syrup and the other corn products are 55 to 95% fructose. And fructose is a driver, is metabolized differently, is a driver of fatty liver disease. And refined carbohydrates, and particularly gluten, because this again drives a lot of the gut dysbiosis and other things. We avoid animal products and high salt foods, and primarily in terms of dairy, it's fermented dairy and unsweetened, kefir and yogurt. And again, whole foods without food additives and preservatives that seem to have a number of undesirable effects. So these food choices will help to reduce gut dysbiosis and fatty liver disease. You can manage your meal timings to minimize blood sugar swings. All fits together with avoiding with improving the fatty liver disease and the exercise capacity. And again, a plant-based diet helps increase melatonin for better sleep, less pain, and avoiding the sugar-sweetened beverages linked to sleep issues. Some people like a ketogenic diet. We recommend low carbohydrate and slow carbohydrates, but not necessarily ketogenic. But if you are going to do ketogenic, the research favors a vegetable-based ketogenic diet rather than an animal-based diet. And you need to look for we look for an eating plan you can follow for the rest of your life. The easiest way to gain weight is go on a diet and go off of it. If you are on a ketogenic diet, you may need to be monitored in terms of some of your lab levels. We recommend that you arrange your meals so that you fast for at least 12 hours a night. This helps to reduce the risk of diabetes and breast cancer through research done by one of my co-authors. So you want to eat meals. You don't want to snack. You want to avoid eating between meals, going around always having Starbucks or something, and not eat during the night or not eat too close to bedtime. Allow the gut to have a cycle where the gut empties and the gut can regenerate itself, and the bacteria in the small intestine get rebalanced instead of constantly feeding sugar to the gram-negative bacteria that keeps them propagating. So we've basically covered this. Try and manage your life so you can get the sleep that you need, adequate time in bed, including the period from 2 to 4 a.m. if you can avoid shift work and things that they require you to do that. Eat the foods that will support good sleep. Avoid inactivity and get healthy exercise. And this all fits together. You want to make sleep a priority. You can get this guide for healthy sleep from the NIH. It's a free online publication that gives the detailed instructions for good sleep hygiene and how to arrange your time, your bed, everything. If you do have trouble sleeping and you suffer from insomnia, cognitive behavioral therapy for insomnia is the recommended solution. You can start with this app from the Veterans Administration. Following this link, they will give you the instructions on how to do this and help you with some forms and record keeping. And treating insomnia with sleeping pills or alcohol is not effective. These do not provide beneficial sleep. They interfere with the sleep architecture and don't give you the benefit, even though you may get knocked out and spend time in bed. Again, check with your healthcare providers for factors that could be affecting your sleep duration or quality. Particularly, there are certain medical conditions that can interfere with sleep. There are certain medications or dosing schedules that can interfere with sleep. And again, if you need to be screened for sleep apnea, these are all conditions that can be addressed. Again, we recommend a plant-based diet, specific timing and recommendations. You can consider supplementary melatonin. This may help, and is a relative. It's a low risk and something that is available over the counter. And improving your immobility will help. Now, sitting is the new smoking. That people are spend much too much time in the same position, engaged in something, watching something. The body's reaction to this is that things must be seriously wrong, that the body thinks that you may be injured or shut down. So it starts hoarding resources when you don't move. Movement is important both for keeping you healthy and for moving the lymph via the muscle pump and for maintaining gut motility and moving around to keep the gut functioning. Even just getting up and sitting down again and walking around a little bit can help keep your body functioning. And of course, inactivity, it can also lead to automatic eating, which is another one of the things that you want to avoid, where you just mindlessly eat anything that happens to be within reach. So again, starting with food and with sleep, and then gradually you can start to increase exercise as you are able to, and as you can do safely. If you have not been exercising, get the advice from a professional, start gradually, avoid injuring yourself, and this will help you with all of the other factors that we're talking about in terms of building up your endurance, building up your muscle mass, improving your desire to sleep, improving your ability to sleep, and making your sleep more efficient. Now, I've added a little bit, given the current era, about COVID-19 risk reduction, because again, this all fits together, and all of these factors play into COVID risk. BMI, being obese, is a modifiable risk factor for COVID. If you are obese, you are more susceptible to COVID, and your infection is more likely to be serious, because obesity impairs immune function and increases infection susceptibility through changing the mix of gut microbes. And you can start to repair the gut dysbiosis by following our recommended eating pattern. And this is a process that will take time, but you can get started on it. And it will start to happen within a couple of days or a couple of weeks, and gradually you begin healing. Also, there have been some identified risk factors with deficiencies of vitamin D and C. And these are very, very common, both in people with lymphedema and lipedema, and older people, and housebound, and people with dark skin are susceptible to vitamin D deficiency. You may take some work to find if vitamin D supplementation that is effective for you. You may also need to supplement the other vitamins and minerals that, again, these deficiencies are common. Melatonin turns out to have a really interesting role in COVID-19 because it helps fight viruses, and viruses fight back by inhibiting melatonin production, which has the effect of disrupting sleep. It's a complicated relationship between the melatonin, which I'm not going to try and explain, but it does help fight against the cytokine storm, the inflammation, the oxidation, and the virus-induced gut permeability and dysbiosis that we see with COVID and other virus infections. And there are some people that think that melatonin has potential as an adjuvant treatment for COVID-19, but there's very little evidence to support that at this time. But it's again, you can boost your melatonin levels by following a plant-based diet. You can consider supplementation. It's safe and has very little risk of side effects, and it's available over the counter. And these recommendations in terms of pandemic health are similar to the recommendations from this nutritional psychiatrist at Mass General in terms of following a Mediterranean eating pattern with whole foods and healthy fats and fiber, vitamin B vitamins, prebiotics. This is inulin, especially. It's a particular type of fiber, and this is explained in much more detail in the nutrition guide. And probiotics, the foods that contain live bacteria that help maintain the good bacteria and the good balance in the gut. So here are some resources, and I will make the slides available. There's the Guide for Healthy Sleep from the NIH, Matthew Walker's book on sleep, and of course our lymphedema and lipedema nutrition guide. And I see we have a number of questions in the box, and we'll start to look at those. You can also email me with questions. Okay, this request is for cited research regarding female. Can we gather male impacts would be less, more, about the same? A lot of the female issues in terms of things where we talk about lipedema, we talk about female issues because lipedema in men is very rare and has basically gotten almost no research. But for lymphedema, that affects both sexes. So that's about all I can say about that. Okay. Lab tests to test levels of zinc, magnesium, iron. Yes, this is talk with your healthcare provider. There are tests for this. They can help you with getting tested and supplementation. Question: what about melatonin supplement? Enter sleep. Yes, so the melatonin supplement. I think the question is, when should you take a melatonin supplement? And basically, you should take it about 30 minutes before bedtime because it will make you sleepy. All right, elaborate about the relationship between gluten and lymphedema. The relationship between gluten and lymphedema is that couple of things. Many people have some degree of sensitivity to gluten. And what this does is it irritates the lining of the small intestine. It makes the lining of the small intestine more permeable. It allows the endotoxins from the gram-negative bacteria to enter the bloodstream and circulate, where they have many effects. They're highly inflammatory. They also interfere with the pumping action of the lymphatic system, so that endotoxins or lipopolysaccharides have been shown to make lymphatic vessels leaky, to stop the pumping action, and just generally interfere with lymphatic function. It's also the gluten and the highly processed. The gluten also is a highly processed food that tends to raise the blood glucose very quickly, and it's generally just something that you're best to avoid. All right, how much melatonin would be beneficial from supplements. All right, the standard melatonin dosage is it's available over the counter. It's a 3 milligram time release. That's the normal dosage. There are some people who recommend higher dosage, which can cause daytime sleepiness, but I would start with the standard dosage. Okay, so the next question is, what are your thoughts about keto-based diets? I and my colleagues who have done the nutrition guide are not big fans of a ketogenic diet. But the most important thing is that people find an eating plan, not a diet, an eating plan that works for them, that they can stick with, and you can plan to stick with for the rest of your life. And some people find that they can stick with ketogenic. Others find that ketogenic is too difficult. And so if you go on and off, you're likely to promote weight gain. And if you are on a ketogenic diet, there are many different ways to do a ketogenic diet. There are diets that are high in meat. There are diets that are primarily plant-based. We recommend plant-based ketogenic diet if you're going to do keto. Otherwise, we recommend what is basically low and slow carbohydrates. You don't necessarily have to be in ketosis, and monitoring ketosis can be tricky, but you can get the gut healing and the other benefits without necessarily being ketogenic. But you've got to find what works for you, particularly for lipedema, which is very individualized. It's frequently accompanied by hypermobility or Ehlers-Danlos, which affects gut structure and function, as well as other things. So you've got to sort out what's going to work for you. Okay, so this person has lymphedema in the legs and also paralysis from polio, and cannot do leg exercise because of leg paralysis. Will upper body exercise be of benefit? Yes. That seems pretty obvious to me. You need your upper body strength. Your upper body strength will help you with your lymphatic function, with your cardio fitness, with everything else. But you need a somewhat specialized exercise program, and I would think that you need to consult with a physical or occupational therapist who can help you with this. All right, another question: do deep breathing or exercises or pranayama help improve short sleep? I don't know. I have not seen any research on this or looked for any research on this. It probably will. I know the lymphatic yoga and the others generally their view, and there's some basis is that it helps everything. Again, and I do know, because in my other life, I do things related to anxiety, because my wife is a clinical psychologist, Dr. McMahon. We have published her book on overcoming anxiety and panic, and I know that the deep breathing, the belly breathing helps calm anxiety and improve all of those conditions. So I would think that would help. Again, we can look for more research on that. Okay, you mentioned intermittent fasting very quickly. what about the 16-8 diet? Can you maintain it lifelong? Okay, yes. I did mention intermittent fasting very quickly. There is some benefit that shows health, but there is some research that shows health benefits from intermittent fasting. I have toyed with the idea of doing a whole separate talk on benefits of intermittent fasting above and beyond what we have in the nutrition guide, because there is some research showing that it can improve immune system function. What about this 16-8 diet? I'm not familiar with that. We recommend basically the hours that are in the book. Can you maintain it lifelong? I can't answer for you. The key here is finding things that work for you in your living situation, with your environment, with your other responsibilities, with everything else. I hope that you can find something that works for you long term. Okay. Any link to enlarged lymph nodes in the groin area? That would be the inguinal lymph nodes and lower extremity lymphedema. Yes. Are supplements helpful when there are no medical issues found? Okay, enlarged lymph nodes in the inguinal area at the where the legs meet the trunk, and obstruction in the lymphatics in that area is a major cause of lower extremity lymphedema. Supplements may be helpful. I'm not sure when there's no medical issues found, if there is lower extremity lymphedema, that is a medical issue. So yes, this similar advice to what we've covered. Okay. What sources of protein do you recommend on a plant-based diet? We recommend plant-based proteins, simple plant-based proteins. I'm not a big fan of highly manufactured meat substitute products. I'm not a fan of gluten-based meat substitute products, which are frankly many of the tastier meat substitutes are gluten-based. Beans, edamame, tofu, other plant protein sources rather than highly manufactured food products. All right, the next question, and we're running towards the end of our time. There's growing awareness of the positive effects of vibration plates on lymphedema and lipedema. What are my thoughts? This is, there have been various vibration devices proposed and various studies to show, and some of the studies that I have seen have been of just absolutely embarrassing quality of research with very small sample sizes and no control. It's at one level, it's almost any movement is better than no movement. But the effects of the vibration plates are less clear. Again, it's finding something that works for you and that's going to be effective. Our bodies really do need to move. We need to move our muscles, because this is the muscle pump. The muscles are aligned with the lymphatic vessels. It's the muscle movement that helps to make the lymph pump. And you need to do the work to get the benefit. And the vibration is better than nothing, but it's probably not as good as actually exercising. regarding plant-based keto, I don't have a specific percentage recommendation for plant-based keto because I'm not recommending plant-based keto. But it's, again, you need to look at those who are look at the information that's available to you there. We recommend lower carbohydrate. It's got to be what works for you. And I think that brings us to the end of our time. I thank everyone for their questions, and I will look forward to reading through all the things that are in the chat. And thank you to LE&RN for the opportunity to do this.